I'm really delighted to be here and to share my research. So as you can see, I looked at exploring parent and carer knowledge, confidence and access to information when they're applying for an EHCNA, as I will call it today. So a bit about the problem. I think we're all probably quite familiar with some of the kind of challenges and problems, and this for me was very much driven from my placement experiences, my prior experiences, and also the literature base. So in terms of navigating the statutory requests, they're often seen as kind of very complex and difficult to navigate. There's a lot of misconceptions, so not just with families, but actually with professionals as well. Sometimes people misunderstand the code of practice and what actually should be happening. System-wide issues, we could talk at length altogether about that. I suppose some of the ones that were really pertinent to this was the rise in tribunals, timescales not being met. I think it's now reached 50% being met nationally or something, the 20-week timescale. So kind of lots going on, you know, lack of resources, lack of money, all the things that we're very, very familiar with in our work. And then in terms of the literature, there's a really strong narrative of parents and carers feeling like they have to fight to get what they need for their child. And again, I think that's something that probably resonates in terms of our work and what we see. And I guess the last one there is sort of the overarching thing, that there's quite a lot of dissatisfaction. When you talk to parents and when you read about it, a lot of parents are not happy with the system, they feel let down by it, and there's a kind of breakdown in trust. So all those things together kind of brought me to my research. So the three kind of key reasons that struck me as I was sort of trying to find exactly what I wanted to look at was that part of the Children and Families Act and the Zen Code of Practice, a big part of it is about parent partnerships. Parents as partners, parents are empowered. But actually, to be empowered, they have to have information. And actually, I felt like that was really missing in terms of the research that was out there, like looking at what parents understand of the system and how are they being supported. And then relationships. So in the cases where it is successful, it's often written as being like about one person, so people often talk about one professional who made the difference. So that factor seems to be really, really important. And then the thing that drove it in total for me was kind of social justice. I had a hunch that certain parents were being less well supported and might not have access to the information they need. So for me, I was really curious about what that actually looked like, and I wanted to do a bit of quantitative data to try and sort of explore that a bit more. Methods, I did a mixed method design. I did an embedded research design, so my quantitative research was the kind of main bit, and then I did some qualitative that sort of complemented the quantitative data. If you'd asked me at the start of this course whether I'd have done a quantitative project, I'd have said no way. It's not my sort of bag, but I absolutely loved it. I think Christopher was saying earlier, there's something like really satisfying about the numbers and the stats. And actually I felt it was really important to build a bit of a bigger picture, so I felt to address the areas I wanted to, I kind of needed to take that approach. Am I all right? So I did a survey, and I had over 300 parents reply nationally. When I kind of drilled down, I think I was able to use 254 responses. There was an appetite. Parents, I think, lots of parents are not happy. There's quite a lot of parents who are kind of very active and wanting to share their experiences. So I was very fortunate that they were willing to share those kind of insights with me. And from the survey, I collected both open and closed questions to collect the different types of data. I did some descriptive statistics and some inferential, so I was comparing means of different groups, particularly parents whose family were eligible for free school meals. I also looked a bit at who was successful or not when they applied for an education, health and care plan. And then on the qualitative side, I did some content analysis. I'm sure everyone felt the same. It's really hard to distill your findings into a few things. So I'm not sure this does it justice, but I was really trying to think about, well, what are the main messages? What did I really learn? And actually I learnt some really interesting things. So the information and support is crucial. So actually there was a statistically significant relationship between parents who were successful applying for an EHCNA for their child and how informed they felt. And similarly, there was a statistically significant relationship between how supported they rated feeling and whether they were successful. So, I mean, there's various reasons that could be the case, but it speaks to the importance of information and how important that is for the outcome of that request. And then I found some really interesting group differences that I maybe wasn't expecting. I've put a few of them here. So yeah, those eligible for free school meals, of my sample, that was about 63 parents. So representative, but not particularly representative of the special educational needs population, where that number would have been a bit higher. But yeah, I found that they were less likely to access information from sort of information and advice services, which I thought was quite interesting, especially given that was one of my primary recruitment avenues. But more likely to get information on the process from us, which I thought was really interesting, and I've kind of speculated about why that might be. A few other things, I don't know if they're particularly surprising, but yeah, those in early years felt much more supported in the process from their school and professionals, which, again, we might anticipate. And then one of the questions was, who supported you the most? Who gave you that support? And we came out as the highest, which again is interesting in terms of actually that question wasn't just, was more about supporting them in the process, which tells me that we're maybe doing a role over and above just providing advice and the kind of needs assessment process. We're actually often a source of support for some of these families. This one will not surprise anyone. Trust is really low. Some really difficult experiences that families have, and there's very much a narrative that I found of LAs being a problem. So some of the quotes I'll show you in a second are quite kind of interesting, and they really speak to that. But some of the data also, parents were sharing that they felt professionals didn't always understand the code of practice and the system, which I found quite interesting. And then I also looked a bit about how much they understood of the code of practice, so I asked them various questions, and there was kind of widespread misunderstandings about some of the myths that we hear, so things like that they need an EP report to be able to apply. So those things that are acting as barriers are widely believed by lots of parents. These were the three, I was going to do it as a bit of a quiz, but I won't. These were the three most commonly answered incorrectly, if that makes sense. So I had 10 questions. I gave a bit more information than this, and they had to say true or false. First one's actually true, and I think maybe not everyone in the room would know that, or maybe they would, and the bottom ones are false. But what is interesting is actually, does it speak more to what's actually happening as opposed to the fact that they're misconceptions? We know the strains that the system is under, so perhaps, you know, I don't know about anyone else, but I've never heard of a GP applying for one, but they could. Some of the quotes that I think give a flavour of some of the themes that I found. Someone left their job for 3 months to kind of just learn about the process. That's how complicated they found it. Feeling like what they were told was false. This need to fight, that came out so strongly. Loads of participants actually used the word fight. They felt like it was this battle that they had to go into. And there was also this feeling of kind of power between the local authority and them, and that dynamic really seemed to play out. So just my final slide, final thoughts. The importance of relationships. Where it did work and where parents felt supported, they would often name a person. Just like I found in that initial literature search, there was often a name mentioned of someone who made a difference. And I think for us today, we could be that person sometimes. It really reminded me about sort of making sure I have up-to-date knowledge. And if I don't, making sure I know how to signpost the families that we work with. So the fact that less families who are eligible for free school meals knew about or access SENDIAS makes me think it's so important that we highlight these kind of support avenues, because there are lots of support avenues, but we sort of need to highlight that to our families. Something came out a little bit about positionality of EPs, so some people just saw us as the local authority, and it made me reflect on the JPLG, if I got that right, advice on our role, and that we put the young person at the centre of what we do. So we might be employed by the local authority, but that's our primary kind of role, and thinking about how I can communicate that with families more clearly. And then if you take one thing away, I think I need to finish. This was my take-home message, that actually I feel really passionately that the quality of information and support that a parent or carer accesses shouldn't be a barrier for their child to access the right support, and actually we can make a difference to that. But of course there's also lots of other big system-wide changes that need to happen. I think that's me.